Okay, hi, this is Cody Zan, and I'm a sports acupuncturist, and I'm also owner of Body Option Clinic. So I am going to make this spontaneous videos for you about runner's knee. I'm going to review 3 unconventional approaches so that you can rehab and treat your knee pain. And I know how annoying it is if you have suffering from the runner's knee, or aka patellofemoral syndrome. So the first thing is properly identify you have a runner's knee. So the first thing you need to be aware of, for runner's knee, the pain is always on the front, below the patella. So if you have pain behind your knee, on the side of the knee, that's probably not patellofemoral syndrome. So now the first thing to do is, the most important thing is prehab. So what's prehab? Prehab is the treatments and modality that you integrated before you get injured. So what does that mean? Is that, so when you have suffering from patellofemoral syndrome, so there's an underlying problem that causes the inability to heal. So the underlying problem is a deficiency in blood flow and oxygen. So the first tip is to integrate blood flow restriction therapy or blood flow restriction training. So I'm going to show you how it's done. Now, so I got my tourniquet here, or you can find a restrictive blood flow restrictive equipment or band or something like that you can hold, that can be wrapped around your knee or your lower extremities. So studies have proven that by integrating blood flow restriction training for up to 10 to 15 minutes and 3 to 5 times a week can improve the blood flow in the tendon that's injured or under heal. So I would suggest you to aim for doing 2 to 3 times to begin with. So now a lot of people ask me, so how much pressure should you be applying for? Now I would say aim for 7 out of 10. So 0 means there's no pressure, 10 being pressure with pain, and 7 meaning you feel pressure with no pain. So you train with it for 10 to 15 minutes with your regular training like squat, lunges, or leg press. So try this out. And of course, if you have diabetes, deep vein thrombosis, or cardiovascular disease, you're going to consult your physician before you go ahead with it. So now let's go to the tip number 2. So tip number 2 is after the running. So if you are suffering from runner's knee, the most annoying symptoms is the soreness after running. So now think about why you have pain or soreness after running. It's because of the inflammation. Now think about why the inflammation occurred. Because it's not healing properly. That's why it's inflamed. Now by integrating L-citrulline is amino acid that helps to dilate blood vessels. So I would recommend take 4 to 6 grams a day. You can try split it up, 2 grams before the running and 2 grams after the running. So at least try for a week straight and see if the symptoms improves, and that can help drastically improve the blood flow and oxygen saturation in your tendons. Okay, now so the last but not least unconventional approach to rehab and heal your runner's knee is Graston, or soft tissue assisted instrument. Okay, so why I choose that rather than any topical medicine or herbal patches? It's because of the very fundamental problem of runner's knee, which is swollen. Now think about why we have knee pain. Well, because of the swollen. The swollen caused the knee, the tendon and the soft tissue to be swollen. So it causes the proprioceptors and other nerve to be detected. So that will translate into pain. Now, if we can use ways to reduce and diminish the swelling of the knee tendon, and that can help to reduce pain. So let me show you how it's done. Now, before we get into the Graston tool, make sure that you can find something on Amazon, or you can buy online. They're anywhere range between $10 to $30, and or if not, you can just use spoon. Just want to make sure that it's not sharp, so that can cause the skin irritation or any damages. Okay. Now, so before I get into it, so make sure you use medium, something like Vaseline or oils or things that can reduce frictions. Okay. So when you're going to do Graston on the knee tendon, on the patella tendon, so make sure your knee is fully extended, fully flexed, so that you can get a full exposure to the knee tendon. Now, if you do it properly, you will hear something like this. Right. So what that does is to help remove any scar tissue or adhesions. Now, if you have developed a chronic patellofemoral syndrome, so most likely you'll probably have developed some sort of a scar tissue as an underlying problems. So scar tissue, as we all know, it restricts and reduces blood flow to the area that needs to be healed. So if you don't remove that, that could be another determining factor why you're not healing properly. So try this at home, but also don't try too hard. And if you like this video, make sure like and subscribe. And if you have any question, leave any comment in this video, and I'll see you next time.